This is Living Better with host Elizabeth Staffier, brought to you by LeCambridge and Point Claire. Enjoy the art of living your retirement to its fullest. LeCambridge.ca.
And good day on this Sunday afternoon. Thanks for taking time out in your day to join me here on Living Better, where we talk lifestyle trends, issues, and concerns, and whatever else might be on your mind. And today we're talking your mental health. Up in our first half hour, are you experiencing the winter blues? And how easy is it to shake off? And could it be something more serious? In our second half hour, ADHD in adults. How common is it, and how can it affect your day-to-day life? So let's get right to it. Feeling tired, irritable, or down in the dumps this time of the year? It's estimated that 15% of Canadians experience these symptoms of winter blues, and it could be a combination of lack of sunlight, less activity, perhaps less socializing that is probably most responsible. Those who become depressed over it may have something further called seasonal affective disorder. The acronym is SAD. They may feel depressed, irritable, and tired. Their activity levels will decrease as well, and they could find themselves in bed more often. This depression disorder might not only affect their health, but it can also affect their everyday life, including their job performance and friendships. Joining me to talk about the winter blues and seasonal affective disorder from the Lakeshore Hospital is psychiatrist Dr. Fiore Lalla. Good afternoon, doctor.
Good afternoon. How are you?
I'm great. Welcome to the show.
Thank you.
And for our listeners, if you have a question or a comment on this topic, you can always give us a call at 790-0800 or text us at 514-800. So, doctor, many of us do get down in the dumps this time of the year. And, perhaps we just chalk it up to it being the winter blues. What's the difference between the winter blues and seasonal affective disorder?
That's a very good question. In fact, the winter blues is something that we all suffer from to an extent because we're not able to exercise during the winter months. Sunlight generally has a very positive effect on us. We socialize less. So pretty much there's, a winter blues aspect to all of us, especially given, our culture and the weather conditions that we have. But when it really starts to affect your functioning, so that you have trouble getting up in the morning, predictably so in a terrible way because you're tired, for example, you've let a lot of your activities go, and you, as you said, you prefer simply to stay in bed. And as part of the winter sort of SAD syndrome, the seasonal affective disorder syndrome, many people actually overeat as well, so they crave carbohydrates. They eat a lot of them and they gain weight predictably. You can see there's a difference in magnitude between the regular blahs and really having it affect your functioning, affect your appetite in that way, affect your sleep level and your energy level to a point where you simply aren't functioning the way that you should be. So when that is in the picture, those level of symptoms are in the picture, we diagnose seasonal affective disorder at that time, which is a variation of depression, which occurs at that pre-programmed time of year when our photo period, the amount of time of sunlight is predictably shorter. And then the syndrome kind of cures itself several months later in April or May when spring comes along. In the meantime, though, it does a lot of damage.
Okay, so I'd like to look at when it does cross the line and is considered seasonal affective disorder, or I guess in the books, in the psychiatric books, it is a mood disorder, and it definitely is designated as such. So how would you know that you're crossing the line? I mean, I have trouble getting out of bed at this time of the year, and, quite frankly, don't want to. I think it's normal for myself to push ahead and just, go through things, but in a more resistant kind of a way. But when does it cross the line that you should be concerned?
It's a good question. It's the number of symptoms that you have and the severity of the symptoms.
Okay.
So if we look at depression, because it is a kind of depression, there are several categories of symptoms that it's important to look at. The first is sleep. So if that somebody is getting much too much sleep or almost no sleep at all, they're insomniac and staying up. Mm-hmm. Their interest level goes down considerably, so that the person suffering from depression doesn't really have much in the way of interest, doesn't even want to watch TV, doesn't want to go out with friends. The next is feelings of guilt and hopelessness, so that the affected patient or client doesn't feel that their life is worthwhile, and they feel very guilty for feeling this way. The energy level is decreased as well. And lastly, concentration, so that they can't read a book or watch TV even if they wanted to, because their attention and concentration level are affected. So when these symptoms combine, so it's not just feeling blah, it's also having almost all of the symptoms that I've pointed out to you, at least 5 out of 7 of them. That means that you crossed the line. You are no longer having simply a seasonal blah kind of an episode, the winter blues, but you've gone over into frank seasonal affective disorder.
Okay.
And it's predictably happens during the winter months from year after year.
So I guess that's how it's different from regular depression, which is perhaps more ongoing and is not seasonal. Am I correct?
That's correct.
Okay. We are talking about the winter blues and also seasonal affective disorder. If you have a question or comment, give us a call at 790-0800 or text us at 514-800. So, Dr. Lalla, how common is it? I mean, does the prevalence of this winter type of seasonal pattern vary with the sexes, if you will? So, for example, are women or men more affected?
Women are much more affected. The ratio of women to men affected by this disorder is 4-to-1.
Wow.
And it's not exactly understood why. It has to do with the differences in biological nerve chemistry between women and men. So it's not to be sexist. It's a real difference that's there, and it's thought to be very, very biologically based. And it affects about 5% of the Canadian population at any one time. What's interesting as well is as you go south in latitude, that is towards places like Florida, the southern U.S. As you approach the equator, the frequency of the disorder decreases because during the winter months, those most southerly regions have what's called a bigger photo period. It's not the amount of sunlight necessarily. It's like whether it's bright or not. It's the actual number of hours of daylight during the day that makes the big difference.
Okay, go ahead. Sorry.
No, that's it.
Okay, so what about, so we talked about latitude, and Canadians, I guess, are perhaps more susceptible, obviously. What about age?
It actually seems for some reason to get better with age. It's one of that also distinguishes it from regular depression, because generally with age, many people who have suffered from depression have worse depressive episodes. With age, it seems to get better, and the prevalence of it seems to get better as well. So with age, it tends to actually get better. But what happens is many of these people have, during the depressive episodes, a very, very peculiar symptom, which I talked about, which is carbohydrate craving to the point where it's almost, for many patients, it's almost an eating disorder. And they can accumulate huge amounts of weight from one year to the next as they have the disorder, so that even though in older age they don't have it as often, or it tends to get better, they've accumulated over the decades or so sometimes a huge amount of weight from year after year as a result of the binge eating, which is a very, very peculiar symptom of this depressive episode. Because as you know, in depression, most individuals actually lose weight and do not want to eat.
All right, Dr. Lalla, next, how SAD, seasonal affective disorder, or the milder form called the winter blues, can be treated and make a difference to your frame of mind.
Living Better with Elizabeth Staffier on News Talk Radio CJAD 800.
Some people suffer from symptoms of depression during the winter months, with symptoms subsiding during the spring and summer months. Seasonal affective disorder affects 500,000 people every winter between September and April, peaking in December, January, and February. The winter blues, a milder form of SAD, may affect even more people. A diagnosis of seasonal affective disorder can be made after 3 consecutive winters of specific symptoms such as depression, anxiety, overeating, lethargy, social problems, even sexual problems, and then if they are also followed by complete remission of symptoms in the spring and summer months. Joining me to talk about this disorder, appropriately acronymed SAD, is psychiatrist Dr. Fiore Lalla from the Lakeshore Hospital, who is also sits on the board of the Lakeshore Foundation. If you have a question or comment, give us a call at 790-0800 or text us at 514-800. So, Doctor, this depression disorder, it really is legitimately a mental disorder. And, you know, the major, let's say, depressive episodes that occur in this seasonal pattern, what are some of the symptoms? I know you talked about overeating, but how can it get really bad that you don't function during this period of time?
Well, it gets to the point where the tiredness and what sometimes distinguishes it from a regular depression is that there's a huge amount of tiredness. There's that overeating that we spoke of. There's a lot of attention and concentration deficits during the day. One way I conceptualized patients and the way they talk to me, how they feel during this time, is they feel like bears that have been woken up during hibernation. Mm-hmm. They're tired, they're hungry, their attention and concentration is poor. Plus, they seem to cry very spontaneously and get sad very easily as well. So it's a mixture of the regular symptoms of depression plus these other ones that I've indicated to you. And I think the watchword, the most important thing to look at, is function. Mm-hmm. So we have some people with lesser degrees of this who have the winter blues who are able to function. That's not to say, by the way, sometimes even in winter blues, we do use some of the same treatments, such as light therapies, for example.
Okay, so I'd like to talk about that because there must be a way to perhaps even prevent it from getting worse. And so how can sufferers treat themselves if, let's say, the symptoms are mild?
Well, if the symptoms are mild, so that they are the winter blues, for example, mm-hmm. not a full-blown depression. So stuff that does work is exposing yourself to sunlight as much as possible. So taking walks early in the day and later in the day. So walks a couple of times a day. Exercise is very useful. It's super useful. Okay. Having something like the Mediterranean diet, a healthy diet where you avoid sugars and you concentrate on healthy foods, proteins. This has all been shown to be very useful for those people who have the blues, the winter blues. Exercise probably being the most important one.
Because I guess it affects certain serotonin or other levels, right, in the brain?
That's correct. And for winter blues sufferers, it's been shown that you can optimize serotonin in the brain through exercise, and the jury is still out, and there's a huge war going on in the scientific community as to whether it has to be aerobic or anaerobic exercise. Mm-hmm. That means aerobic means cardio, anaerobic means doing weights. But basically, it's sort of leaning towards the cardio part of the equation. Okay. But the exercise, probably the most effective and strongest lifestyle modification that helps in terms of depression prevention or treatment is exercise. Okay. And that's particularly true in that population, the winter blues population.
All right. Now, what about treatment with light therapy? Quickly, how does that work and how effective is it?
It's fascinating. It's very effective. You can use antidepressants as well to treat the disorder, but in light therapy, you have to use this very special medically approved device on the advice of your physician, which is actually quite bright, and you put it about 10 to 18 inches from you for half an hour early in the morning, that is before 8 a.m. And what this does is it increases your levels of serotonin, and they believe also sets your internal clock so that you don't quite feel like that hibernating bear that's been woken up, your clock is synchronized with the season. We have in Montreal, we have one huge manufacturer of these lights called Northern Lights Technologies. Now, my advice to everybody who's interested is you don't need a prescription to get this, but I would talk to your doctor and get a prescription because it'll be covered by your insurance. It'll be medically a lot safer because your doctor will look it over first to make sure that you're an appropriate candidate to get light therapy. Okay. And you'll get a medically approved device, one that's on the up and up and works. Be very careful of scams on the internet selling SAD lights. Light systems, you have to get a medically approved one.
I think that's a good point because I think even if you have any bipolar issues, it could potentially trigger a manic episode, if I'm not mistaken.
That's correct. Yes.
Okay. Next, final simple tips that can make a big difference to your frame of mind if you are prone to the winter blues. This is Living Better on News Talk Radio, CJAD 800.
Living Better with Elizabeth Staffier on News Talk Radio, CJAD 800.
And joining me with his final tips to manage your winter blues or seasonal affective disorder is psychiatrist Dr. Fiore Lalla from the Lakeshore Hospital. So I have two texts. Doctor, does SAD make a difference if you smoke or does it make a difference if you're a non-smoker? Also, does taking vitamin D help SAD?
We have a very informed population. This is very interesting. Smoking per se is not a great risk factor for any form of depression. Certainly, partially because it plays with your neurochemistry, but also because sleep interferes with, smoking interferes with sleep. So these are some factors which are very, very important. So yes, it can interfere for any form of depression, and certainly however you can try to get off of cigarettes, take the time that you need, but get off them, certainly in the long term makes a huge difference in terms of your basic mental health. Vitamin D, there have been no studies with vitamin D for seasonal affective disorder, but once again, in general terms, out of all the vitamins that have been studied, it appears that vitamin D seems to have the most effect in terms of depressive illness.
Okay.
So I can't make a recommendation, but vitamin D, we know with the regular form of depressive illness, seems to have a positive effect.
Okay, Dr. Lalla, hold your thoughts. I am speaking with psychiatrist Dr. Fiore Lalla from the Lakeshore Hospital. On the other side of the half hour, we'll continue our discussion and look at ADHD in adults and how it differs from childhood as we continue to talk about your mental health.
This is Living Better with host Elizabeth Staffier, brought to you by Lakeshore and Point Claire. Enjoy the art of living your retirement to its fullest. Lakeshore.ca.
Well, we can all agree that life can often be a balancing act for any adult these days. But if you find yourself constantly late, disorganized, forgetful, and overwhelmed by your responsibilities, you may have ADD or ADHD. Attention deficit disorder affects many adults, and its wide variety of frustrating symptoms can hinder everything from your relationships to even your career. Learning about ADD or ADHD is the first step. Once you understand the challenges, you can learn to compensate for areas of weaknesses and start taking advantage of your strengths. Joining me to talk about adult ADHD, the signs, symptoms, effects, and treatment is once again psychiatrist Dr. Fiore Lalla from the Lakeshore Hospital. Welcome to the second half hour of the show, Doctor.
Thanks for having me.
And you're very welcome. For our listeners, if you have a question for the good doctor or comment, give us a call at 790-0800 or text us at 514-800. So, Dr. Lalla, how common is ADHD in adults? I know the focus is often on the children, but if in the past it was not diagnosed, perhaps many adults these days are struggling with the disorder.
It used to be thought, in fact, that children outgrew the disorder, and we know that that is not the truth, that in fact 60% of adults who had it as children continue to have it, and 80% of adults who had it as children, even if they don't have the diagnosis, are struggling with the symptoms of it. And it's almost 5% of the adult population that struggles with it, which is quite a lot. That's a huge number.
Really?
And in fact, these people have struggled with it all their lives. And what's really bizarre is sometimes their children are diagnosed and their children are treated, but they are not. So they've been struggling really since their childhood years and through their academics and everything else and all the other behaviors and symptoms that come with the disorder with time, but they remain undiagnosed but suffer silently with it.
Okay. You mentioned 5% is a huge number comparatively to other disorders, mental disorders. Why is that figure such a big one?
It's a big one because it's hundreds of thousands of Canadians, for example. Mm-hmm. We know, for example, as well that depression it's akin to the kind of diagnostic criteria and statistics for depression, which is it's a similar number, that 5%.
Okay. And
other disorders such as manic depressive disorder and schizophrenia are only at 1 to 2%. So we're talking several
a significant number.
We're talking a significant number of Canadians suffering with this.
Okay.
Now, Elizabeth, not everybody needs treatment. Mm-hmm. What's really interesting is with the development of our social technology and stuff like iPhones and other ways to help organize and schedule ourselves, some people cope.
Right.
They're able, to schedule their lives and get on with their agendas and do things on time. But there's a huge number who don't cope.
So what I'd like to look at is how does it change from childhood? You said that it was thought that, they outgrew it, that children outgrow it. How does it change? How does it evolve when you become an adult?
That's a super interesting area of science right now because we know that attention deficit disorder is a neurological condition. It is not a psychological condition per se, it's a neurological condition. And with age, the symptoms seem to change. And they become more related to attention and concentration being the main symptoms versus hyperactivity being more of a symptomatology when it occurs in kids. We thankfully don't see too many adults being hyperactive per se. It still happens. Adults with attention deficit disorder can fidget in their seats a lot and not be able to concentrate because they have a constant need to move. But more often than not, it's the symptom profile that you described, which is those individuals who are not able to attend to their schedules, be on time, get stuff done, pay their bills through that benign neglect. And I treat many individuals who have that set of symptoms where their homes or their apartments or wherever they live is completely full of paper because they can't sit down long enough to attend and concentrate to do it or to be on time for anything.
Okay, so you mentioned that it looks like or it is a neurological condition. I got a text in as well that says, is ADD inherited?
Very much so. In fact, its inheritance is much stronger. I talked about the different diagnoses before in terms of their prevalence in Canadian society. It's to the point where if you have a child with ADHD, your odds yourself of having ADHD in many studies is close to 50%. It is a disorder that's almost as inheritable as height. In the studies, where there is a genetic contribution such that the disorder is transmitted in the same way something like height is. So that's a pretty strong genetic link. And it's to the point where in fact, if you have a child with ADHD and you have some of these difficulties that we've talked about, that you should yourself be checked out by a physician to do some questionnaires and go through some history to see if you, in fact, are suffering from ADHD.
Okay. Now, what is the sex distribution, meaning more women or men are affected, and are there stats on this?
Yeah, there's lots of statistics on it, and what's interesting is that in children, there's an almost 4-to-1 ratio, again, between boys and girls. when
So
they're
more
children.
more boys getting it than girls?
And with time, in terms of adult ADHD, the sex distribution is almost equal,
Okay.
which is really interesting. We don't know why the reason for that is. Part of it is the disorder gets better in time with a lot of people, so they may lose it. For some, what's really interesting is that ADHD in little girls oftentimes isn't picked up, because little girls with ADHD have the inattentive type, so they may not do well in school, but they're quiet, they're not disruptive, they're not diagnosed.
Okay.
Whereas
Interesting
boys
point.
have the hyperactive kinds of symptoms and take up all the attention of the classroom.
So there might be a huge segment that's not diagnosed on the female side. Now, do you think it is over-medicated, and what is the alternative?
What's happening is it is not over-medicated. I mean, right now there is a movement amongst Canadian doctors and families who suffer with the disorder to sort of educate others to show that it is not being overdiagnosed. It's in fact being very much underdiagnosed. Only 1 in 3 children who have the disorder are ever treated for it.
Okay.
And the same statistic holds for adults. Sorry?
Well, in terms of medication, because I'd like to go into the alternative of meds and this and that. So let's say they are treated. In terms of how adults are treated, is it through medication, or are there other alternatives, like you were talking about technology and all that?
Living Better with Elizabeth Staffier on News Talk Radio CJAD 800.
Attention deficit disorder often goes unrecognized throughout childhood. This was especially common in the past when very few people were aware of ADD or ADHD. Instead of recognizing your symptoms, your family, teachers, or other parents may have just labeled you as a dreamer, perhaps a goof-off, troublemaker, or just a bad student. You may have been able to compensate for the symptoms of ADD and ADHD when you were young, only to run into problems as your responsibilities increased. So, as you were pursuing a career, raising a family, running a household, the greater the demand on your abilities to organize, focus, and remain calm, the more difficult, perhaps, you found these challenges. So, joining me to talk about ADHD in adults is psychiatrist Dr. Fiore Lalla from the Lakeshore Hospital. If you have a question or comment for the doctor, you can give us a call at 790-0800 or text us at 514-800. So, Dr. Lalla, before the traffic break, I was talking about medications, and I know with kids there has been reference to the fact that the initial reaction for doctors is to give medication to temper some of the behavior problems. What about the same going on with adults?
Well, it's interesting you bring it up, because it's a huge discussion. But to make it simple, basically what happens, as I said, not everybody who has ADHD as an adult requires medication if they have some of the technology or ways of organizing themselves, first of all. Secondly, if you want to treat the illness, medication is necessary, and I'll tell you why. It's been discovered and worked on for years that it's very much of a neurological phenomenon where those parts of your brain that are responsible for organization, time management, controlling your impulses, for many reasons it has shut down or really lowered its function, and the medications effectively turn that on. Now, once you've done that, you can then use psychological or behavioral interventions to help people get their lives back together, because the medications don't work 100%. They help the situation, but they give you the attention and concentration ability to make your full usage of something like psychotherapy afterwards. So it's unavoidable, but they've been studied. The meds have been studied now for over 50 years in the treatment of this disorder, and we have very, very safe formulations of medication that people can take in the long term that helps them to basically organize themselves, and then we can use psychotherapy and behavioral therapy afterwards to help them perfect and to work on what's left over. And that's generally my method of treating people. But right from the get-go, I can tell you that not everybody who has adult ADHD necessarily needs treatment, but if they are suffering a lot of functional problems in their lives because of it, or have gotten themselves into trouble because of the ADHD symptoms, then certainly they should see their doctor and try to get on some treatment.
Okay, so undiagnosed and untreated, it could you are suggesting that it can cause some huge problems in virtually, I guess, every area of your life. I guess relationships, your home management, I guess even things like hoarding, if you don't know how to manage certain aspects of your life, right?
That is correct. The statistics, and they're sad statistics, of what happens to untreated patients with ADHD over their lifespan includes stuff like secondary drug abuse, teenage pregnancy, lethal car accidents. Sometimes we'll hear doctors or other people say, "Oh, stop your medications on the weekends because you're not in school." Well, you know what? That's when kids get in trouble. is on the weekend while they're driving or rock climbing or doing other things. You want them on their medications so their attention, concentration, and impulsivity control are optimized. So basically, the medications can be very effective. Like, as I said, not necessarily for everybody, but they can be effective, and they open the door to psychological interventions, because it's hard to do psychotherapy or these other therapies if you can't think straight in that way. If you lack attention and concentration, it's very difficult to do a complex psychotherapy, right?
Right.
So,
And how do you do the neurological testing? I mean, how do you know that somebody has ADHD? What kind of test does an individual go through?
that's a great question. In fact, the vast majority, it's said that 80 to 90% of adults or kids that suffer from it do not need neuropsychological testing, like where you have a psychologist give you hours of testing to check on your reaction times, attention, concentration, and everything else. We use two methods together. The first is that there are new scales that were developed by the World Health Organization. It's called the ASRS. You can try it yourself online if you want, but that's not the final diagnosis. There's a scale, and there's also the history that a doctor takes. And the history that a doctor takes focuses in on what I've just told you, talking about time management, organizational problems, problems with procrastination, problems with impulsivity. So if you have the history that I've just talked to you about, plus a scale like the ASRS, that together is used for the diagnosis.
All right.
The last thing that's needed is that you have to understand that if somebody as a child did not have academic problems or any of these behavioral problems when they were younger, it's very unlikely that they're suffering from ADHD. Now, sometimes stuff like substance abuse and depression looks like ADHD, which is why you should see a doctor to try to get that comorbidity or those other diagnoses looked at or taken out of the equation.
Very good points. Next, final insight from Dr. Fiore Lalla, psychiatrist at the Lakeshore Hospital. This is Living Better on News Talk Radio, CJAD 800.
This is Living Better with host Elizabeth Staffier, brought to you by Lakeshore and Point Claire. Enjoy the art of living your retirement to its fullest. Lakeshore.ca.
Well, obviously, a diagnosis of adult ADD can be an enormous source of relief and hope. I guess it would help one understand that they're not to blame, and, their difficulties are not the result of personal weakness or even a character flaw. With his final insight, Dr. Lalla, if you had anything to say to a person who is struggling and may think they have ADHD, your recommendation?
Certainly go to your doctor. You can read up about it. You may want to try the ASRS scale, which is online, and as I said, is an approved scale from the World Health Organization. But don't, see your doctor. Don't let the problem fester and continue to cloud up your life through all the difficulties that you're having. Once people are treated, it works. The treatments work very, very well and open the door to a whole new world.
Okay. And also, I think you want to give a plug to the Lakeshore Hospital and the Lakeshore Foundation.
That's I've been. So I thank you for that segue.
Yeah.
I've been at the hospital for almost the last 20 years, and certainly we're doing great things. We cover an area of 250,000 people. We are one of the largest servicing hospitals on the island of Montreal, and I know that there are a lot of people out there who have drawn benefits from the hospital. I would influence you, please, to look at the Lakeshore General Hospital Foundation website. There's a lot of really great stuff there, and we have 2 or 3 really interesting events coming up for the members of the West Island community. Our Christmas wrapping at Fairview. If you're going to go to Fairview, just use our services to wrap your gifts for you. Give a couple of dollars to the foundation. It would be fantastic. And my event, which we have in the month of March, which is the Baton Rouge annual event, in conjunction with the Lakeshore Hospital Foundation, which is a hoot. The theme this year is the 1960s. It's going to be a real party. It's one of the best parties in the whole West Island that happens ever, and I'm not saying that because it's my event, but it is my event, so I guess I get to toot
And I
my
thank
heart.
you so much. I
Take
do
care.
have to let you go. Thanks
Will
so
do.
much for